Good day, everyone, and welcome to today's teaching. The topic for today is assessment and planning of public oral health programs. I am Promise Ucheka, your presenter again for today. This part of this teaching today is part of the series for public oral health programs, and today we are looking at the assessment and planning. The first part was the introduction to public oral health program using the logic model. And today we're looking at the assessment and planning for public oral health program. And the other video is about implementation and evaluation of public oral health programs. The aims for today will be to introduce the concept of and the steps involved in the assessment, as well as the planning of the public oral health programs. So do not forget, like I said, this is the second part of this series that's of 3 parts. The first part is the introduction. The second part is the assessment and planning, and the third part is the implementation and evaluation of public oral health programs. The objective for today is to introduce the steps necessary for the assessment and the steps necessary for planning of public oral health programs, okay, and to introduce the use of logic model in the assessment of public oral health programs, and also the use of logic models in the planning. So we will stop at the planning for this particular teaching at this time. So the next one is the implementation and the evaluation using logic model. So by the end of this session, you should be able to discuss the steps that are necessary for the assessment of public or community oral health programs, and you should be able to also discuss the steps necessary for the planning of the same program. And in addition to that, you will be able to discuss the use of logic model in the assessment of in both assessment and planning of public oral health programs. So this is going to be what I will expect, that if you're able to follow us through to the end of this teaching, you should be able to remember and discuss this particular points. So the full series will cover the planning, the implementation, and the evaluation of public oral health programs, and to a bit of a revisit to using logic models. So the first aspect of what we are going to do now is to revisit what we've talked about with regards to using the logic model, okay? And this is a template that you can look at when you think about the logic model. And remember, we've said before that you don't need all these elements that are listed on this template. They are like prompts, things to get you for you, the things you need to be thinking about when you are doing when you're trying to do an assessment and the planning of a public oral health program. So you should be able to use this template to think about what you need to do. And for every program you are planning, you should be able to draw your own model, okay, using this template, so you can get elements of the things in this template and use that to create your own model. So your own model will involve the assessment of the situation, which is in the area when you are thinking about your community. You are thinking about what the problems could be. You're thinking about, you're trying to set up the priorities and all that. And then you have the element which is in your input, or the things you tend to put in. for the oral health programs, and your output, your outcome stroke impact as well. So this is the stage when you think about it. So this module is here to guide you in trying to decide or to create your own model on how you will execute your oral health program for the population of your choice. Okay, so these are the stages of a logic model. So you have the assessment stage. So this is about you now trying to assess what the situation is. You assess the resources, you assess the cost, you assess just thinking about the situation that you want to tackle and trying to make sense of the things that it will involve. Okay, so this is you making a proper assessment of the situation, and then the next step is the input. You need to know what is your input, what do you need to be able to do this program, and then the next step will be your output. Okay, your output, and then your next step will be to think about the outcome. So thinking about the output, you're thinking about the things you're going to do at the place. If you're confused about these stages of a logic model, revisit the teachings that we've done before on the introduction to the logic model, where we broke down different stages, different kinds of outcome, different kinds of output, and different kinds of outcomes. We said that for different kinds of outcomes, we have the short-term outcome, the intermediary, and the long-term outcome or impact of your teaching. So we will also revisit that when we begin to talk about in the other module, in the other presentation, where we talk about the implementation and the assessment or the evaluation, of the programs. Okay, so you see in this slide, you see how this arrow is used to indicate the movement, okay, in direction. So the assessment, you do assessment, and then the next step will be the input, the next step will be the output, and then the other step will be the outcome or the impact. Okay, thinking about the stages as well in your planning, you're trying to execute an oral health program for the public or for your community. So there are about 4 stages you need, so you need to do assessment, you need the planning, you need the implementation, and the evaluation stage. And we will see in the next slide, we'll be looking at how these stages of planning, these stages that you need in your planning and in your planning of an oral health program, or in your running an oral health program for the public, how these stages fit in with the logic model. So we'll be seeing that in the next slide, where we have listed out the assessment. So these are the elements of the logic model in parentheses, and these are the elements of the oral health program in on the left side of the slide. So the assessment, I'm sorry, I've clicked in error, so it's unfortunate I might not be able to go back to the other slide, but you'll still come across that. We've talked about it in the introduction, and we will talk about it again in the other video. So planning, implementation, and evaluation. So now we're doing the assessment. So in the assessment, what do you need to do? In the assessment, what exactly are you assessing? So the most important thing you are assessing here is the situation. Okay, so you are presented with a situation where you need to do an oral health program for a particular community. It's either a community that you have chosen for yourself, or a community that you've been told to do a program for. So this will be determined by where you are working, or whether you are running a personal program. Okay, a personal program. Okay, so whether it is a personal program or you're working for an agency or the government, the steps that you need to consider remains unchanged. So in the assessment, the first thing you need to assess will be the situation. You look at the community. We've talked about oral health needs assessment. Please, if you're confused about this, refer back to our teaching on oral health needs assessment. In oral health need assessment, we've told you about the stages that you need to go through and the things you need to do in order to determine what the oral health needs of a community is. Okay, and now when you have done the assessment, you use that assessment to know exactly of all the needs of the community, which one are you expected to make a priority, or which one are you deciding to make a priority? They are not all of the same, importance. They might not all be of the same importance to the community. So you have to be able to make a decision on that. And doing that, you also think about the stakeholders. Okay, you think about the stakeholders in the community. Who are the people that you will be liaising with in order for you to be able to plan, execute, and evaluate the program? Okay, so you need to think about, in your assessment stage, you need to decide who are the stakeholders for this community, and who the stakeholders will be will depend on what community you are using. Okay, we've talked about stakeholder involvement in our previous classes. So you always refer back to the things that we've done in other classes so that you can be able to, decide on who your stakeholders is. So when you have identified the problem and then you think about the needs and the assets for this program. So what are the things that you will need to be able to execute this program, and what are the things that you can say these are your assets? Okay, so when you're talking about needs, you might not begin to think about the professionals that might be involved. If you need any professionals to be able to, execute the program, you think about the kind of knowledge that you will need, you think about the kind of resources that you will need. So you consider all the needs, the things that you are going to need to be able to execute this project. And also when you think about that, you also think about the assets that are available to you. What are the resources that you have that can help you facilitate your accomplishing your mission for this program? Okay, so when you have done this assessment, at this point you begin to make decision on setting out the vision for the program. You need to have a clear, well-defined vision for your program. You can't just run a program without having a vision of what you want to achieve, what you intend, to for this to achieve in your community. Okay, so you define your vision and also you define your mission statement. So you need to have a vision statement and a mission statement for your program. And then, continuing with the assessment, when you have defined your vision and your mission, you can now be able to set values. Okay, so you set values. There are so many things in the planning of the oral health programs. There are so many things that could, be proper, coming into your mind, and a lot of things that will be happening. So you need to set values. Okay, you can't do everything in the program. So you need to set priorities, set values, and then you set a well-defined mandate. So you need to set a time frame that between now and here, regardless of how long or how short, this is what you intend to achieve. You set up a mandate. So the mandate can be given to you by your employer or by your superior, or if you happen to be the employer or the superior yourself, or you are running a solo program, then you can set the mandate for the people that are working for you. But for any oral health program to be well planned and executed, you need to set a mandate. These are the things that will guide you from the stage of the planning to the stage of the execution and evaluation of the program. Okay, so when you do this, I've mentioned before, you consider the resources that are available to you. You look at the local dynamics to think about what is possible and what is not possible, what is going on ground and what is not going on, what do they have and what do they not have. So you put all these things into consideration, and it's also important to think about collaborators. In an oral health program, there are so many organizations that you can collaborate with. You can collaborate with, manufacturers of, oral health products. You can collaborate with manufacturers of equipment. You can collaborate with, educational institutions or hospitals, or there are so many people, there are so many organizations you can collaborate with depending on what program you are running. So you need to be able to also find out who are the potential collaborators that you could use to execute your oral health program. So now, when at this stage now, what you should be doing is you've decided already on your population, either that you've done that by choice or it's been assigned to you, or that you are the one in charge of a defined population. So first of all, before you can do anything, you need to know who your population is. You look at the dynamics of the population and you understand them. At first, you do the oral health need assessment or general health need assessment, if that is not already done, because I've told you before, there are areas where routine data is collected on health from different communities. So if there is routine data available for your community, then you can use the already available data to make decision, do analysis, and decide on what priority you will be working on. If that is not there, then you can do it from the scratch to be able to get to know the population that you are dealing with. So you've decided on your population, you decide on your community, okay, and then you conduct oral health need assessment that I've said, either that it is there for you or you need to do it from the scratch. It's up to you depending on the resources you have and where you are, and then you decide on the oral health need that is of public health importance. So you find out that in your assessment that the community you are looking at might have multiple needs. So you should be able, as the professional, to decide on which of these needs is a need of priority. And remember, we have talked about how to decide public health problem. Okay, so they might have multiple needs, but you need to consider which one of them qualify as a public health problem. So you only focus your interest on those that qualify as public health problems, and depending on the resources you have, including time and money, you'll be able to decide on how many of those you can tackle in this program. If you are looking at a single condition, then you have to be able to decide on that, and you need to be able to justify why you believe that should take the priority in your program. Okay, so when you have set out your intervention priorities, then you can now move on to the assessment, to the planning of your program. Okay, so this stage will be the planning stage. So at the planning stage, there are things you need to consider. So what I've done in this teaching is to get a bunch of questions that you need to ask yourself in order to help you plan the program effectively. So there are so many questions we are going to be asking. So you think about these questions and so many more questions. There is no way I can put all the questions in this slide. So I've just given you samples of questions that you need to ask yourself following every step of the planning stages. Okay, one of the things you will think about when you are doing your planning is time. So you need to understand how much time that you have or how much time that you need. So it's either the time you have or the time that you need to run this program. So that will be dependent on the situation surrounding your program. So it's the program assigned to you to run, how much time was assigned for that program, or are you proposing a time frame for your program? How much time do you need for your program? So you need to think about time, and that time will begin with the time that you need to plan the program. So when you're talking about time, you're not just talking about the time it will take to execute the program. You need to also think about the time it will take to plan the program, because you can't just snap your fingers, find yourself at the intervention stage and begin to execute a program. You need to plan the program, but you also need to think about time. So you ask yourself, how much time do I need to plan this program? And then you also consider if you can plan the program alone, or you need to plan the program with a group, you need help. So for instance, planning alone, it could be that you are the initiator of this program, you want to do it by yourself, and then you sit down and plan the program, and then you begin to think about the people that will help you execute the program. However, in some situations, depending on the size of the program, it might not be advisable for you to plan the program alone, because there might be so many oversights if you are planning alone. But if you plan with the help of a team, your team members might be able to think about the things you're not thinking about and might be able to help you. You should be able to come up with a better planned program if you plan with a team than to plan alone. But this is what you need to ask yourself. Do you need help to plan this program, or can you plan the program by yourself? So you think about it, you ask the questions, and you know what the answers will be. And then you also thinking about time again. The next thing you will think about, or one of the things you should think about, will be staffing. Okay, so if you have decided that you need people for this program, so you begin to ask yourself, at what stage do you need people? Do you need people as staff that will work for the period of the program, or do you need people to volunteer for the program? So you think about and decide whether you need staff or volunteers. Okay, you think about whether you need staff or volunteers. So that will be important in executing. That will be important in you trying to execute this program. Okay, so you decide whether you need staff or you need volunteers, and then you think about the time. Do you need to hire this staff for the program? If you need to hire staff for the program, how many people do you need to hire? What expertise do you need to hire? At what stage do you need to hire them? So these are the things you need to think about. Okay, you need to think about hiring staff. Is it important to hire staff? Can you actually find people who can volunteer so that you don't need to hire them? What are the advantages of hiring staff, and what are the disadvantages? You think about the advantages of staffing over volunteering, over using volunteers, or the advantages of using volunteers over using staff. So these are the things you need to consider while you are planning your program. Okay, then you think about the number of people that you need. You don't want to understaff the program, and you don't want to overstaff the program. Okay, then how long that you will need this staff for will depend on what stage you want them and what kind of staff you're looking for. Do you need staff who will just plan the program and that's it for them? So you can need to staff at the stage of the planning. You may need them at the stage of the implementation. So it could be a different set of people that will plan the program, and then you need a different set of people to execute the program, or you need a different set of staff during the evaluation. So the kind of staff you will need will depend on the expertise that you need, and we will talk about that later. But it's important to get you thinking about who you need to plan your program. Okay, so at this planning stage, you might want to plan the program alone, or you also might need help. We've said that, to plan the program. So in this planning, you plan for the staffing. And the next slide, we'll be looking at volunteers. Okay, so you decide again on whether you need staff or volunteers, or both. In some situations, you might need both staff, the people you are going to employ and pay for the period of the program or for a specified period, and you might also at the same time need people who will volunteer. So you might need both. You should be able to decide whether you can manage both staff and volunteers or you need one set, but that will be determined by other things that you need to put into consideration. So talking about volunteers here, so there are a lot of questions you can ask yourself about the use of volunteers. So can you access some volunteers? How can you find people to volunteer for the program you are running? And who are the right people that can volunteer for your program? How do you get access to the potential volunteers and who are the potential volunteers? You think about, like in an oral health program, you think about people who are still dental students who are probably doing their clinical years. There will be a good access for your program. Okay, you can easily access them and they may be a good asset for your program. So you think about using dental students as volunteers depending on where you're running your program, and you might also have access to some fresh graduates who are fresh in the market, looking to acquire experiences in a community oral health program. So they might be readily available for you, or you might need to advertise or source for them. So you need to think about how can you find them and how can you source for them. When you have them, how can you manage them? Are you able to manage them alongside staff, or you are able to manage them alone without having staff, or do they have enough experience to execute your program, depending on the level of at which you are planning the program. So these are the things you need to think about while planning a public oral health program. Moving forward, you think about the knowledge and the expertise that is needed for the program. Okay, talking about the knowledge, you ask yourself if you have the knowledge that is required. Okay, you have the knowledge that is required. You ask yourself, do you have the required professional knowledge, or do you need to hire people that have the required professional knowledge? By saying this, we are talking about from the stage of the planning. Do you have enough planning skills? Is this your first program to plan? Do you need to tap from the experience of people that have planned and executed bigger program or programs of such magnitude in the past, or can you do it by yourself? Do you have that knowledge? Do you have the professional knowledge that is required to be able to execute this program? Okay, do you have enough professional knowledge, or do you need professional? So who will you need to hire professionals? We've asked that question. And then if you need to hire professionals, from what stage do you need to hire professionals? Do you need to hire professionals from the planning stage throughout the period of the program until evaluation, or do you need to hire professionals at the implementation stage, or you need to hire professionals to do the evaluation for you? So the kind of professional skills and knowledge you need will determine the kind of professionals you will need to hire and at what stage. Also, you think about how many professionals do you need for this program. You think about the professionals you need for the planning, professionals you need for the implementation, and the professionals you need for the evaluation. And then you ask yourself this very valuable question: can you get these professionals to volunteer instead of hiring them? Okay, can you get them to volunteer? If you can get them to volunteer, it will be a good way to cut cost. But if you cannot get them to volunteers, how many of them can you hire? So these are the things and so many other questions that you can think about when you're thinking about the knowledge base for the program you want to run. Still under knowledge and expertise, you ask yourself who will be the experts. Okay, and before you ask about who will be the expert, you ask yourself what expertise do you need for the program. So now we are talking about our public oral health programs. So you have made an assessment, you have determined which oral health problem you want to tackle. So it is from that stage you now begin to think about who the experts will be. Are you the expert? Do you have the expertise to implement your program? If you have the expertise, are you enough to do the program? Is this program small enough for you to handle, or will you need to employ more experts? Okay, how many experts you need, you think about that, you ask those questions, and when you have determined the expertise, you determine how many people you need, and you also determine how you will find the experts. How can you assess them? Where are they? Do you know who they are, or do you need help finding the experts for your program? Then another valuable question you need to ask is, do you need to hire these experts, or can you get them to volunteer? It is very important to know if they can volunteer for this program, that would be great. If they can't volunteer, are they available for you to hire them? And if you're hiring them, you think about time again. For how long do you need to hire them? Is it from the beginning to the end, or at a particular time of the program? Okay, if it is at a particular time, which particular time of the program are you hiring them? Are you hiring them at the beginning, at the middle, or at the evaluation stage? Still on the planning, you think about the materials and the equipment that you need. Okay, so while thinking about the equipment that you need, or the materials that you need, rather, you ask yourself, what materials do you need for the program? Now, the materials you will need for the program will be linked back to the oral health problem of priority, how you've set your priority. The materials you need to tackle a particular disease or tackle a particular priority might be different. For example, if your priority is an intervention, the materials you need for an intervention will be different from the materials you will need if your priority is educational. Okay, so if your priority is educational, you will see that the materials you will need to execute a program that is education-based will be different from the materials you will need to execute a program that is intervention-based. Okay, and then you ask yourself about the availability and the accessibility of these materials. Are they available for you? Do you need to buy these materials? How can you buy the materials? Have you thought about the money, the cost of buying the materials? Okay, are you going to create them? Are you going to have them donated to you? So before you decide on any of these things, you need to know what materials you are looking at. So this is part of your planning. You do the same thing for the equipment as well. For the equipment, you need to ask yourself, what are the equipment that you need for this program? And now this will be determined by the nature of the program. Okay, and then do you already have this equipment? You already have this equipment. If you are a practicing oral health professional, you might find out that you may have access to some of this equipment, either because you have them previously or you can get them from your colleagues, okay, or that the organization that you're working from already have it. So the equipment that you need, whether you will need to hire them or you will need to buy them, will depend on the nature of the program that you are running. Okay, is this a one-off program, or is it going to be a recurrent program? If it is a one-off program, you can now ask yourself if the equipment you have already are enough to run the program without you having to either hire or buy a new or fresh equipment. If you don't have the equipment already, you look around to see if you can borrow this equipment, or you can have people donate this equipment to you, either permanently or for the period you are running this program. Now, if this program is going to be a recurrent program or something that is going to last over a few years or a few times, then it might be cheaper to buy the equipment if you don't have them. Because if you have to hire the equipment over and over again, you'll find out that by the time you hire 3, 4, 5 times, you might end up spending more money on the hiring than you would have spent on purchasing the equipment. So these are the questions you need to ask yourself, and you think about this deeply for you to be able to plan about the materials and the equipment that you need for your public oral health programs. So you think about the space and the technology. Okay, talking about space, you ask yourself, where will this program be executed? Where is the site? So now you've made an assessment of your community. Where can you do this program? Do you need a space? The space you need, do you need to hire it, or is there an existing space? Do you need to create the space, or do you need to use an existing space? If there is an existing space, do you need to hire it, or do you need to liaise with the people in charge of the space to let you use the space without having to pay for it? So you need to think about the space, and you need to think about, while thinking about the space, there are things that will determine where you will be executing your program. You've thought about, and you've made an assessment of your population, your community. What is the population you are targeting? How many people are you targeting? Are you going to have them all in one place, or is it going to be a one-day program where everybody will come? Is there going to be a crowd, or is it going to be a recurrent program where people will come in groups and others? So you think about all that, and you make a decision about the size of space you need and where this space can be and whether this space is available. Now, where this space can be is also important when you are thinking about the people that will get to this space. How will they get to this space? Do they need to travel to this space, or are you able to bring this space to them? Okay, you think about that as well. You think about this issue of space is something very important to consider while running your program. Okay, while planning your program at this stage, you need to plan very accurately and ask yourself multiple questions relating to space. And also for the technology, you ask yourself, what technologies do you need and do you have access to them? This is really important to know and understand this at this planning stage. Okay, you don't need to leave any stone unturned so that you don't get choked at your program. The effectiveness of the implementation and the possibility of the implementation and the effectiveness of this program will be determined on the planning. So the planning stage is one of the most important stages of the program. Okay, if you don't plan your program effectively, you will not be able to implement an effective program and you will not get the outcome you desire. Now, the last thing we will be talking about in this stage will be about money. Okay, now you've decided everything that you need to decide concerning this program. The next thing you ask yourself is questions relating to money. You have to estimate how much this program will cost you. Will it cost you money, or will you be able to run the program without money? I doubt it, but if that is the case, good luck. If it is not, then you think about how much money you need. Okay, how much money you need. How will you fund your program? You've planned a very good program, but how are you going to fund it? Now, there is a thing you need to consider. In certain situations, you might be planning your program based on an available fund. Now, if the fund is available, then that will determine how wide your program will be. But if you are planning the program without funds, then it is the program that you have planned that will now determine how much money you will need. Okay, so when you know how much money you need, you now begin to ask yourself questions relating to how you will find the money to fund the program. You're thinking about the cost of the materials, you're thinking about the cost of the space, you're thinking about the cost of everything that you need to ask yourself multiple questions. And this is why it is not good to plan a program alone, because there are things you might forget. But if you have people who are planning this program with you, they might be able to think about the things you have not thought about, except if there is already a template that you need to follow in order to plan the program, where everything had been written previously for you to just look and pick so that you don't make mistakes. If not, you might need help planning the program. Okay, still talking about money, you ask yourself, will you need to reimburse your volunteers? So say they have to travel for the period of the program, or they need accommodation, they need feeding. How will you fund for that? Okay, do they have to spend their money while they present a receipt to you and you reimburse them? Or are they willing to volunteer without you having to reimburse them anything? What about the participants? Are they going to travel? Do you need to reimburse them the travel fare, or are you going to provide travel and transportation allowance for them? Or will you make that travel possible? Are you going to hire a van that will take them, or are they going to come by themselves? So these are the things you need to think about. You think about the wages that you need to pay to the staff that you have hired. Who is going to get this money? You think about how much the wages will be, how many staff you need, how much money in total, and how will this money be raised, and how will it be allocated to them? Who will decide how much you have to pay the staff? Who makes the decision? Is it you, or are you following a guideline that is already there for you to follow? You think about accommodation. If your volunteers or staff will have to travel to a different location, how will they travel? Will they be able to return back home and come back next day, or will they need to sleep over in an accommodation? You think about the cost of providing the accommodation. Think about refreshment for the participants. Are they going to be able to eat? Are they going to have something to drink? Are they going to have access to water or soft drinks? Or are you going to compensate them or motivate them with something? So you think about that refreshment, you think about if you need to give them something. And then it is very, very important to think about how you can cut the cost of running this program. There is no need to waste the money. There is no need being extravagant in your spending. You need to decide on priorities. What is more important? What can you do without? What can you save money on? What can you minimize the number you need? What can you get rid of and still run the program effectively? What are the excesses that you don't need? You need to be able to find a way to cut costs in order to save money. Okay, you save money, you don't waste all of your money or spend all of your money or run out of money in the middle of the program. You need to be able to account for the money that you have. And at this point, I believe we will be finishing this part of this teaching here. This is a link to some resources you can read on your own. In the other ones, we also have further links to resources that you can read on how to plan and execute your program. Thank you so much for listening and following this teaching to this very last slide. And that is me saying thank you, and check out the next presentation on the implementation and evaluation of public oral health program. And also remember, if you having issues with health need assessment, you check out our presentation on how to determine and set priorities for your oral health need assessment, or with oral health need assessment for the program you want to run. If you want to go back to the introduction to this public oral health program, you're welcome to check out the next and the other presentation. Thank you, and this will be the end for this presentation.